In this video, we are going to be talking about ECG. Basically, whenever we think about the heart, people think that it's the pump, it circulates blood. And that's correct. There's nothing wrong with that understanding. But there is an entire component that we're missing here, which is electricity. Electricity. So this signal tells the heart to contract. What contracts is the muscles of the heart. After these muscles have been activated, they need to go through something where they can be activated again because you would want your heart to keep beating for longer. Starting from the start, you have the electrical activation, which leads to contraction. And now, after the heart is contracted, we need to have some form of a recovery. We need the heart to be ready to go through this again. So when we take an ECG, we are not looking directly at the heart. What we're trying to do is we are trying to get to understand the electrical changes which happen in the heart. Imagine that the heart is a house, a nice, pretty little house. As you would have with a house, a main electrical switch. This electrical switch, in our case, would be the SA node. The SA node generates an electrical impulse and sends it through the heart in a specific pathway. That pathway is of interest to us because it will help us understand how the heart is performing its job. Pathway goes something like this. First you have the SA node, then you have the atria, then you have the AV node, then you have this bundle which gets divided into right and left bundle branches, which then gets divided into the Purkinje fibers, which finally supply the ventricles. So this electrical wave basically travels through the heart and tells you which part of the heart is being activated. Step number one, the atria. As we talked about earlier, SA node is the part where the electrical impulse starts. This spreads across the atria. The muscle of the atria becomes depolarized. This can be seen in the ECG as the P wave. Now you must be wondering, what is depolarization? When the heart muscle is resting, it has an electrical state. When an electrical impulse reaches that cell, the ions move across the cell membrane and this electrical state changes. This change is called as depolarization. In other words, depolarization is the electrical activation of the cell. So when you think about depolarization, you should think that the cell is switched on. Atrial depolarization, the atria becomes electrically activated, and that results in the P wave that we see in the ECG. What happens in the atria shortly afterward is that the atria contract, and the blood inside of them is pushed into the ventricles. Now, this electrical signal reaches the AV node. The AV node is important because it slows the signal down. This is because we don't want the ventricles to contract immediately. There should be some amount of time before the atria had a chance to push the blood into the ventricles. And so the AV node basically slows down the electrical signal so that blood is able to move from here to here. From here, the pathway goes something like this. You have your AV node, the bundle of His, the bundle branches, and finally the Purkinje fibers. Eventually, through the Purkinje fibers, the electrical signal then goes to the ventricles. It spreads rapidly through the ventricles, and this leads to ventricular depolarization. In other words, as we discussed earlier, as with atria, ventricles here become electrically activated. This can be seen on the ECG as the QRS complex. Just to recap, the P wave was the atrial depolarization, and now the QRS is the ventricular depolarization. If the atria is activated and the ventricles are also activated, how do we make sure that the next beat happens? Both of these are in the on state. Now we have something called the repolarization. As we discussed with depolarization, the switch was on. In repolarization, what we are trying to do is reset the system. Resetting it to what? To its resting state. Because previously we got the heart to be in the on position. But the thing is, the heart can not be in the on position forever. So we need to recover it electrically back to its resting state. And that is where repolarization comes into picture. So repolarization is electrical recovery or the reset. Now this is seen as the T wave. So we have got all of our elements P, QRS, and T. As we talked earlier, P is the atrial depolarization, QRS is the ventricular depolarization, and to get to the reset stage, we have the T wave where we have both the ventricular and the atrial repolarization. You have the heart muscles, which produce your heartbeat. And how do we go about it? Firstly, we have the activation phase where the muscle is activated, which leads to contraction. And then there is the reset. So here you have the switch is on, the job is being done, and reset. Talking about the ventricles, here QRS does the depolarization, and then you have the T wave. This process of depolarization that we have been talking about is electric. That means we are sending in the signal. What follows through is the mechanical part. That is the contraction which happens. So in an ECG, we are not seeing the contraction, rather, we are seeing the electrical signal. So ECG shows the electrical event that led to the mechanical contraction. Let's start from the start. You have the SA node. It fires, generating the electrical impulse, which leads to atrial depolarization, which, as we discussed, appears as a P wave. Then the AV node causes delay, as we discussed earlier, to give time for the atria to fill the blood into the ventricles. This part is seen by the PR interval. From here, we go to the His-Purkinje system. The signal now travels thoroughly and rapidly through the ventricles. This causes the ventricular myocardium to be electrically activated, which is seen as the QRS complex. As the ventricles have been electrically activated, now they contract manually and pump the blood into the pulmonary artery and the aorta. As the ventricles have done their job well, now we will give them a little treat, and that treat is they can go to a state of rest, and that is the repolarization, which shows you the T wave. And after all this, the heart is ready again. Now we'll talk about some other ideas. Firstly, the PR interval. PR interval is measured from the beginning of the P wave to the beginning of the QRS complex. It represents the flow of the electrical impulse from atria through the AV node through the Purkinje, His and Purkinje fibers and the ventricular myocardium. As we discussed earlier, the AV node is the major site of the physiological delay, which is needed for the blood to go from atria to ventricles. However, the PR interval is simply not the AV node. This will be helpful to us when we later talk about AV blocks and other things. One last thing before we end the session. Depolarization does not mean contraction. As we have been talking about this in terms of the electrical signal, depolarization is rather something which triggers the contraction, but it is not the contraction in itself. Similarly, repolarization is something which causes the electrical signal to be sent for recovery. So when you think about QRS, you should not think that this is ventricular contraction, but rather that this is ventricular depolarization, which triggers the contraction in the ventricles. And when you think about the T wave, you should think that the ventricles are undergoing the repolarization process, which leads to the resting state. But it is not the resting state in itself. To sum it up, ECG is basically recording the electrical activity. In the future videos, we're going to go in depth with all the other parts and hopefully have fun with learning about this. I am trying to make sure that, I explain these videos, not in such depths that people get scared and leave because of the pathophysiology or the physiology aspect of them, but rather that, people have a chance to connect with this on a fundamentally simple level. So yeah, that's it. That's all for me today. Thank you.